Something that I get asked all the time is about temporomandibular joint dysfunction. So if you have questions about temporomandibular joint dysfunction, jaw pain, then you need to watch this video. I want to make sure that I mention that if you don't have specific training on doing this, then don't attempt to do any of this. But I want to make sure that we're educating people and showing them what it is that can be happening for them and things that they can do about it. So in this video, we're going to talk about how the jaw, the neck, and the upper back, how those things are all intricately linked and connected, and how there's a relationship there, as well as research that's done by oral care providers to support what we're going to be talking about here structurally, and then real world application. So a lot of times research can get kind of like heady. I want to show you this is what it means in the real life, and this is what it means in real world, and I'll show you that too, and it'll be really easy to understand, but it's going to be good information and great content to have your brain wrapped around there too, as well as home exercises to help with correcting the temporomandibular joint dysfunction and the dysfunction of what's going on with the jaw. So let's dive into that. Let me show you exactly what's happening here. We're going to look at this particular patient here. Watch a couple of key things. So watch what happens here and what happens here. So first things first, look at that. This is her condylar head, and so that jawbone that comes down right there. Watch how that translates forward. So let's watch that one more time. You can't miss that, right? Like, you just can't miss what's happening there. One thing that you might not be noticing is what's happening here on the front part of her jaw. Notice when she opens, her jaw goes down, right? So it goes, and see how it dips out a bit? So it goes not just a nice smooth arc, it actually bumps forward, and that's because of what's happening with that condylar head too. So as she's sitting here like this, right? As this moves forward and translates anteriorly, as it moves forward, this jaw does the same thing. The apex of her chin pushes forward too. So all of that moves on a hinge, and it should be nice and smooth as in moving down and back, but hers doesn't. So we had to make sure that we address some specific things there to ensure that we got the care that we needed to for her. So let's talk about what are the things that really come to play here as far as the research that's supported by oral care providers to show, hey, these are things that we need to make sure that we're addressing here too. So when we're looking at the research, there's a couple different things. This research here, this is from the American Association for Dental Research, and basically they state that, look, if you've got a diagnosis of temporomandibular joint dysfunction, you've got something like that going on, you need to make sure that you examine the head and neck. Here's my thing, I look at it from this perspective. There's not going to be anybody that has more experience for looking at what's happening with the teeth and occlusal contacts and what's happening with the jaw than an oral care provider, a dentist, an orthodontist, an oral surgeon. However, when it comes to examining the head and neck, who's going to have more experience with that? Well, it's typically going to be a chiropractor that does that on a regular basis. They're going to have the experience that's doing that just on day in, day out. They're going to be the ones that are looking at that on a consistent basis too. We each have our specialties. I would not want to, as a chiropractor, be looking at somebody's occlusal contacts, and most oral care providers don't want to have anything to do with looking at somebody's head and neck to determine what's going on there too. It's just not their wheelhouse, and that is not my wheelhouse. But when we work synergistically, when we come together and we co-manage cases, that's when we get the best results possible. So we've got that going on. That, look, if we've got a diagnosis of jaw pain, TMJD, we need to make sure that we're looking at what's happening with the head and neck. Same thing here, right? That the Journal of Applied Oral Science, they say this, cervical spine disorders, so problems in your neck, problems in your cervical spine, those disorders, arthritic change, degeneration, problems as far as not functioning and moving like it's supposed to, those things are going to be perpetuating factors. That means that it's going to be problems that are going to continually cause issues with the temporomandibular joint dysfunction, or TMJD. Whenever we have that going on, we've got to make sure that we're addressing what's happening here with the cervical spine as well. Otherwise, we're not addressing the whole problem. This is why a lot of times we hear patients that say, I've tried everything, but it's not working. It's getting me there, I'm getting better, but I'm not completely better. I still have this problem going on, it's not getting fixed. It's because we need to look at it from some different perspectives to bring things together and get a complete and whole picture. And I'm going to show you how that really functionally looks too. The other thing is this, is that the Journal of Applied Oral Rehabilitation says that, look, problems with internal derangement, that means problems with your jaw and the temporomandibular joint, we have issues there, they're significantly associated to the cervical spine, even when you don't have subjective neck complaints. So that means that, look, they look at it and they say, if you have a problem with your internal derangement, you have a problem with your temporomandibular joint, even if you don't have complaints of neck pain, complaints there of your neck, then we have to make sure that you're still looking at that. You're still getting that examined. We still need to examine what's happening in the cervical spine, in your neck, to make sure that we get everything taken care of. So even without cervical complaints, even without complaints of the neck, if you have a diagnosis here of TMJD, we need to make sure that we're looking at this too. Those were supported by cranio and clinical oral investigation too. It's just we're finding that those findings are being supported no matter where it is, because these things, the jaw, neck, and upper back, those things are all intricately linked. Let me show you how that is. We're going to test it, you and I, right now. So this is what we're going to do. We're going to have you sitting up good and tall. And when you're sitting up good and tall with good posture, I want you to open and close your jaw. Just feel your teeth come together. They come together within 1/10 of a millimeter of each other. Now the next thing I want you to do is just feel how that is and just relax that jaw. And with that jaw relaxed, what I want you to do is I want you to go back into extension. And go back into extension so you're looking up at the ceiling. And when you do, open and close your jaw. Feel those teeth come together again with the occlusal context. Do you notice how whenever that happens, those teeth, the bottom jaw slips backwards, right? It shifts posteriorly. When that happens, it's because now those occlusal contacts are different because of how the jaw and the neck and the skull all intricately linked together. Now think of it this way. Next thing I want you to do is, with your jaw relaxed, I want you to look down. And when you look down and flex your head down, I want you to open and close your jaw. Feel how your jaw shifts forward? What do we do most of our day? Most people throughout their day are looking down. They're looking down to do their things on their computer, looking down to help their kids. They're looking down to do things with their pets and their animals. They're looking down to be on their phone, right? So we're on those things and we're doing all that stuff all throughout the day. So the question is, if we're doing all kinds of things here to the jaw, which in most cases, that's what we should be. We should be addressing what's happening here too. If we don't address what's happening in the cervical spine, then the problem is those are going to be perpetuating factors, just like the research said. It's just going to continue to be an issue because of the fact that we aren't addressing what's happening in the cervical spine. Now, it's more than just, oh, well, I'll just stop looking down as much. I'll start looking forward. Well, great. But if we have problems in the cervical spine, whether or not there's pain or not, like the research said, if we have problems in the neck where those vertebrae, those individual bones aren't moving like they're supposed to, they aren't functioning like they should be, it's going to affect the nerves that come out there too. Those nerves are then going to irritate the muscles of mastication, the muscles that create that ability to chew, right? So all of these muscles are controlled by the nerves that come out by your neck, and if we don't address those, get those functioning correctly, we're going to continue to have problems, and it's going to be a continual cycle. So we have to make sure that we're working together with oral care providers to make sure that we get all the results that we want. That way the oral care provider can focus on what he or she needs to, and as the chiropractor, we can focus on what we need to. Everybody gets to focus on the thing that they're best at. So let's go back to this patient. Remember, we were looking at the condylar head, we were looking at the jaw, and how everything was moving. This particular patient was referred to us by her oral care provider, and we were able to work with them to really help her get the results that she wanted and get them working better and better together in harmony, as in the jaw, the cervical spine, everything. Now watch here. I want to show you this, where we're seeing what it ends up looking like now. So when she opens and closes her jaw now, look at that condylar head. Nice and smooth movement. That's the way it should be. The other thing is that you notice here too. Notice how her chin, whenever she goes to open, opens down and back, down and back. Now, her oral care provider and I, we were each working together to do what we needed to do to help the patient. Yes, we did things where we're addressing what's happening with the condylar head and making sure that that jaw is now functioning like it should be and getting to be more stable, staying stable within the joint. That condylar head should move within the fossa nice and stable. In the other case, she was moving too much. There was too much movement in there. We need to get it more stable. So we did things to adjust this area and work on the muscles as well as what's happening in the cervical spine, the neck, to address that and get those nerves functioning like they're supposed to as well. So, what can you do? So one common thing is, here's the thing, is that the temporomandibular joint, it's a really dynamic joint. So it's hard to say, this is the one thing that everyone should do if you have jaw complaints. It's not. It's a dynamic joint. So we have to remember, these are all done on individual basis and what's specific for that person. But what I do typically find is that whenever people have a problem with their jaw, they have temporomandibular joint dysfunction, they have a problem with TMJ issues, that they do one common thing, that they typically jaw jut or protrude. And what I mean by that is this, is like you saw in the video there, she protrudes her jaw forward. So what happens with a lot of TMJD patients is they're gonna push their jaw forward first in order to get it to fully open the way that it's supposed to. It's called jaw jutting or protruding. So one thing that you can do to counteract that and work it in a more natural positioning and get that condylar head moving like it's supposed to in there, in this fossa, right? Get it moving like it should be, is do this. It's a really simple one. You're going to suction the tongue to the roof of the mouth. And then when you do that, I want you to open your jaw. When you open your jaw, so you're going to do it like this. You're going to open your jaw down and back towards your throat. So suction the tongue to the roof of the mouth and open. So with that tongue suction to the roof of the mouth, you're going to open your jaw and it's going to go down and back towards your throat instead of protruding out. If you have jaw complaints, that's going to be one of those things that's going to be difficult to do because your jaw has done everything it can right now to adapt to the changes that have taken place within that joint. And so it's trying to make it to where you can open and you can do the things that you need to do. The problem is, though, as it's adapting to allow you to do what it needs to do, it's becoming a repetitive problem, a repetitive injury. We don't realize how much we open and close our jaw to speak and then to eat. So those are things that we have to make sure that we're able to do in a continual way. And that's a really simple exercise to do. If you continue to have problems and you've got complaints with your jaw, we're here in St. Louis. We'd love to be able to help you. I train docs around the world. I train oral care providers. I train chiropractors. I've trained all kinds of different professionals, healthcare professionals around the world. If you need to find somebody, contact info@drtmjd.com. We'll make sure that we can find somebody for you in an area that we've trained. And then doctors that want to learn more, you can find us there on drtmjd.com. We love to help however we can so that you can help so many people that need this. There's so many people out there that need this kind of care that it's just not all being addressed the way that it could be, to where we can all work together to where the patient wins. And that's really what this is all about. It's ensuring that the patient wins the most that they possibly can to get their life back into doing the things that they need to do, want to do, love to do.